In this video, we are going to talk about what your bowel program might look like if your injury is below T12. The learning objectives are listed above. We're going to talk about what a successful bowel program might look like, specific techniques used in bowel programs, and additional ways to support your bowel management. For lower-level spinal cord injuries, bowel programs reduce the risk of accidents, constipation, impaction, and give you more control over your life. A bowel program that works best for you will take some trial and error, but remember that consistently performing your bowel program is key. The consistency of your stool is also important. Diet, fluid intake, activity, and medications will affect the consistency of your stool. The goal is to have soft, formed stool. A successful bowel program should provide predictable and reliable results, take less than 30 minutes per day, have minimal side effects, require the fewest numbers of medications and surgeries, allow for at least 3 bowel movements a week, and will be performed at the same time, either every day or every other day. Keep in mind that the optimal time for your bowel movements is within the first 2 hours after you eat. This is when the colon is most active. To design a successful bowel program for yourself, you should talk to your healthcare providers about your mobility status, including your ability to transfer, your balance, and your hand function. After discovering the appropriate position for your program, you can use your diet, fluids, and medications to create a stool consistency that works for you. It's important to record the frequency of your bowel movements and check the skin on your bottom to prevent any skin damage or wounds. This is just one example of a way that you can keep track of your bowel movements. Using a sort of log like this is helpful to see what time of day you had the bowel movement, if there was any leaking, what the stool consistency was like, if there's any patterns with what you had to eat or drink that day. So this can really help your healthcare team develop a good plan for you moving forward. With a lower level spinal cord injury, the most common technique that's used is manual removal of the stool. It's typically completed in the most comfortable position that's decided upon with you and your healthcare team. Either you or a caregiver will take a gloved finger and remove stool from your rectum. If this is not possible, then surgery should be discussed with your healthcare team. The most invasive and helpful surgery is the colostomy, but it does require general anesthesia to perform. A part of the distal colon is attached to the abdominal wall, as you can see right here. And then the stool collects in an external bag that is tightly attached to the skin. And that's what you see here, the ostomy pouch. The colostomy can be reversed if you would like to return to your previous state or functioning. There are additional ways to support your bowel management program. This can include exercise and standing. Exercise and standing are great ways to improve intestinal motility. The best kind of exercise to stimulate the bowels include those that increase your heart rate and cause you to use your breathing muscles and abdominal muscles. Standing is the simplest way to improve bowel function because gravity will help move the stool through your intestines. You can also use a standing frame to help assist with this. We talked about the standing frame in a separate video, but as a quick refresher, it helps a person come into a standing position. So be sure to keep this in mind when thinking about additional ways you can work to improve your bowel function. Your doctor may have you take 1 or more medications, either orally or rectally. These can also help support your bowel program. It might be stool softeners that make your stool soft and easy to move. They could be stimulant laxatives that stimulate the colon to move stools, bulking laxatives that add shape and form to stools to prevent diarrhea, or rectal laxatives that help with rectal movement and emptying. Overall, to wrap up the information we just covered, individuals with lower nerve injuries must manually remove stool using a well-lubricated gloved finger. It's best to complete your bowel program seated on a toilet or bedside commode, and you'll likely have to complete your bowel program multiple times per day, usually after meals, to prevent accidents and ensure that your rectal vault is clear. Remember that consistency is key. Please reach out to your healthcare team with any questions or concerns you have moving forward so we can help develop an appropriate bowel management program for you.